Good afternoon, and welcome to Monday's coronavirus briefing. Hope everybody in North Dakota had a fantastic Easter yesterday, even though it was under new conditions with all the physical distancing we were practicing. I wanted to start off with some fun news and some good news. We continue to hear amazing stories about North Dakotans who are stepping up to fill critical needs in this crisis, and so I wanted to share a couple of those. We recently learned that Valley City State University and Valley City Public Schools are working together to manufacture 3D printed face shields for healthcare and emergency workers in the community. Valley City Superintendent Josh Johnson shared with us this has been a remarkable example of the power of creativity, ingenuity, and collaboration. And of course, for those folks that are doing distance learning, maybe the parents don't know, I'm sure the students do, but you can access 3D printers online, so you could design these at home and print them at a remote location. But want to thank both the Valley City Public Schools and Valley City State University and all the Highliners and all the Vikings that are making this happen. And then last week in a local news outlet, there was a story here shared about 12-year-old Ian Dietrich in Bismarck, who's using a 3D printer to make a ear guard, as they're called, for local medical workers. I saw them. It fits across the back of your head. You hook the little strings from your mask into this thing that goes across the back of your head, and then your ears don't get sore from wearing a mask all day long, so it's like a ear protector. So I thought that was a great little invention. Maybe that'll go viral like some other things out of North Dakota, so I wanted to say ears to you, Ian, for that great invention. But anyway, thanks to everybody who's pitching in to help slow the spread and support those that have to wear masks. We are all in this together. Today, case numbers for today. North Dakota Department of Health confirmed 23 additional cases today of the COVID-19 out of 431 tests. I want to point out a couple things about this. First of all, we think about net because we had 23 new positives, but we also had 6 recoveries today. So from a net standpoint, this 23 that you're looking at right now in this slide is there's 17 net. That's our third biggest day of net increases. So again, one of the things we're watching for is when might things start climbing up on the curve in North Dakota, but this is our third biggest day. 16 of those 23 cases were under the age of 40, and 2 of them were between ages 10 and 19. So again, while there may be a belief that this is something that is a serious, which it is, deadly for people that are elderly or have and especially elderly and have underlying health conditions. But even if you're a teenager, you can get it, and it may not be fun, because I'm assuming if you're between 10 and 19 and you went in and got tested, it was because you had symptoms and someone was worried about you. So again, just want to make sure this touches everyone, and everyone, regardless of your age. If you have it, you can be someone who spreads it to others, and while it may not be fatal to you, it could be to someone else. Sadly, yesterday we had, over the weekend, a man in his 50s from Ward County passed away from COVID-19. He had underlying health conditions and he acquired COVID-19 through community spread. And then just before this conference, not reflected in the data that we have here, but we did learn that a man in his 80s from Morton County with COVID also died overnight. He had underlying health conditions, was in close contact to someone who had tested positive. His passing is not reflected in today's report, but it will be in tomorrow's. So at least right now, we can expect that tomorrow the total number of individuals who passed will be 9. I want to go back to that first slide. When we had 23 positives and 431 tests, that's a 5.3% average. That's one of our higher days in terms of positive tests per the tests taken. Of course, it was a little bit lower on the test numbers, as is expected. I think we always are going to see lower test numbers on weekends, and maybe especially you might see tomorrow lower test numbers reflected in very few tests being taken on Easter Sunday. So this 5.3 in terms of percent tests that were positive is higher than our run rate of 3.1, but I also want to mention that before, when we've been below 3.1 like we were a week ago, we were doing what was called the surveillance testing, where we had gone to Slope County, Amadon, North Dakota specifically, but tested people from that region, and Gladstone, where we were testing people around the Gladstone, East of Dickinson area. In both those cases, there was no criteria. You could come up, drive through, get tested. So there was a lot of people that were asymptomatic. That was part of what we're trying to find out, is people without symptoms, were they positive or not? We did find out that in the case of those 2 tests last weekend, that of the 6 positives that came from those 2 tests, half of those people, 3 of them, had no symptoms whatsoever. So we know that you can be a carrier of this and not have symptoms. So that was good learning for us and good learning for the nation in terms of rural health. But this past weekend, on Saturday, we'll talk about a little bit more, we did some targeted testing where we went up to Montreal County, and in collaboration there with MHA Tribe, part of the testing that occurred, and some of those are reflected in this numbers, is people we had identified through contact tracing that had been exposed to someone was positive, we invited those individuals to come in and get tested. And so it's natural that when we've got versus surveillance, when it's just, hey, whoever you are, come and get tested, versus by invitation only, we know you've had contact, we're going to have a higher percentage. And that's why we saw this number jump up today in the thing, but it's to 5.3. But again, we're still moving above and below 1.5 to 5.3, above and below that 3%. That 3.1% rolling average is still the second lowest in the nation. Only Hawaii is lower than that. So again, on the next slide, again, when we net out our recoveries from our positives, we're nearing that 200 active cases that are confirmed. As we've said before, there are likely much more of spread than this in North Dakota than what the number of active cases. But a key number that we want to focus on here is number of hospitalizations, and that number is 13. And again, that would represent across our 55 hospitals less than 1% of the total beds in North Dakota. By a lot less, maybe less than 0.5%. So that's the status on that. When we go to the actual curve, which we've shared with you before, again on this slide, above the line is the active tests netted out against the recoveries on the bottom, the recoveries in people who've passed away on the bottom. And again, you can see when you look at this is our 3rd biggest day in terms of a net increase of a net of 17 from yesterday to today. We're going to take a look again at positive rates by counties. We've got some new leaders here. This can jump around a little bit in some of these western counties, where I think Montreal had our highest percentage of testing going into the weekend. But with all the testing we accomplished in Montreal, we found more positives there, but with more testing, the percent of positives went down. Burke County jumped into the lead, but again, when we've got small numbers, these can move around, because that would reflect 2 positives out of 22 tests to get you that 9.1% for the math majors in the room. But again, we are doing testing across the state, and again, people should focus on positives per capita to take a look at where the hotspots are, not on just the number of cases, because we're always going to have a higher number of cases in our areas of higher population, but that doesn't mean we have more per capita or more per person there. Okay. We continue on a couple of things. We've talked a lot about our hospital surge plan. We had meetings throughout the weekend, virtual meetings with a large group of people, including our internal team, the state team, the Unified Command team, the National Guard team, and with all the inputs on the Tier 3 that are coming from Corps of Engineers and FEMA and our own emergency services group, also with all the major hospital providers in the markets that we're looking at initially. In those 2 initial markets that we look at for a Tier 3 plan would be both Bismarck and Fargo. As you know, we've pre-positioned the beds or cots in 200 each inside the Fargo Dome and in the University of Mary Fieldhouse. This is part of that 3-tiered hospital surge plan. These would be considered the Tier 3 minimal care facilities, but as we've covered before, and as you saw today in the data, with only 13 hospitalizations, the work that we're doing to flatten the curve and to preserve hospital capacity has worked, and we have certainly the great work of everybody in the state has helped slow the spread of COVID-19, and the goal still remains is that we would avoid using the Tier 3 facilities altogether. We don't expect to need them, but it's our responsibility to protect the health and safety of citizens, and it's also our job to prepare for worst case scenarios. So we're confident we'll have the capacity if we do have a surge, but we again want to be prepared. But I want to assure North Dakotans that if you're going to need a high level of care, we're doing everything we can to make sure that you'll get that care inside one of our existing facilities today. And these minimal care facilities would be again a very unlikely scenario. Together we can continue to slow the spread and save lives. So again, I want to say to all of you, thank you for being North Dakota Smart. Thank you for staying home, staying healthy, and staying connected. Next up on topic is the executive order for today. Today we issued an executive order just prior to this meeting in response to how the COVID-19 pandemic affects some of our state's most vulnerable children, and those would be youth that are receiving services in what are licensed and called licensed state psychiatric residential treatment facilities or qualified residential treatment programs. If people are unclear about what that would be, we've got some great organizations, nonprofits across our state that work in this critical area and make a huge difference in young people's lives. That would include the Dakota Boys and Girls in Bismarck, Fargo, and Minot, Luther Hall in Fargo, Pride Manchester in Bismarck, Ruth Myers in Grand Forks, Home on the Range in Beach, Dakota Boys and Girls Ranch in Minot and Fargo, and Charles Youth Services. That's across those two programs for psychiatric residential treatment and qualified residential treatment, which is a covered under foster care. But we have a lot of orders that normally regulations, I should say, a lot of regulations that protect the young people that are in those organizations, and we have to protect them not only the way we'd normally, but also protect them from COVID as well as staff. And so this executive order cuts through a lot of red tape that would be super counterproductive at this point in time, including eliminating the needs for some things that might have been in-person routine healthcare checks that may not be available or not urgent, but allows for alternative options like telehealth, allows for employees to utilize online training versus in-person requirements, allows us to use state background checks while national checks are suspended, extends the expiration date of these nonprofits programs by 120 days, which then would delay us having to send inspectors out to do on-site visits, and allows for two-person staffing with the required training. These are challenging times for these facilities and for these nonprofits and the important work they're doing, and the decisions and responses need to be made quickly for the safety of youth and families. And we're all committed to ensuring our youth and families receive quality care while also following the CDC guidelines and social distancing. So again, thanks to everybody that worked in Department of Human Services and on the governor's office team and working with these nonprofits to make sure that we were successfully cutting the red tape they needed to allow them to keep doing their great work and do it safely for both their staff and their residents. Next topic is veterans. Is something we've been thinking about a lot during this last month of this crisis, but something which we want to provide a broad update today on multiple topics related to veterans. The first is just a general veterans update, and this is both veterans and active military. North Dakota is a home to about 50,000 veterans, and we want to start with the obvious, which is we have a sacred commitment to our veterans, and we all understand that freedom isn't free, and that the sacrifices that these individuals have made to serve their country and protect the freedoms that we all cherish is something that we don't owe them just while they're in uniform, but we owe them to them throughout their lifetime. And the goal that we've talked about here in our administration, including the 50,000 veterans and the over 6,500 active military that we have spread across multiple locations, but primarily Minot Air Force Base, Grand Forks Air Force Base, and those that are active with the 119th Wing with the Happy Hooligans and the Fargo Air Guard on those full-time missions. we want to be a state that's regarded as the most military-friendly state in the nation. And there's a number of ways that we can do that, and that's not just showing our appreciation and gratitude on key holidays, whether it's Veterans Day or Memorial Day or other days like that. We want to make sure we're doing this every day. And then from that, I want to say thanks to our legislature, because last year, 2 key pieces of legislation, waiving the requirements for trailing military spouses, waiving the licensure so trailing spouses could work in North Dakota in their respective fields, and then also waiving the North Dakota income tax on military retiree pay. This was key because other states had done that. We had people retiring from Grand Forks Air Force Base that were moving to Minnesota, even, if you can imagine. We're supposed to be the low tax state. So we had we've eliminated that low taxes for those veterans, and again, great work by the legislature to do that. It's our responsibility to make sure that all these folks are receiving their services and care they deserve. Later this week, we've reached out and we'll be connecting with U.S. Secretary of Veterans Affairs Robert Wilkie. Of course, he's been in North Dakota, and we've met with him in person here. So we'll keep in touch with what's going on at the federal level to ensure care for veterans. But here's a few other topics that we're working with here in North Dakota to help our veterans and keep them safe. Number 1, North Dakota Veterans Home. Not every state has their own long-term care facility for veterans, but North Dakota has and continues to support, including with a brand new facility that was opened in 2001. It's in Lisbon, North Dakota. It sits on 90 acres. It's a beautiful, beautiful site if you've never been there, but now is not the time to visit because we've restricted visits since March 13th, and to just the residents and the staff that are there. We're fortunate that the Veterans Home has had no cases of COVID-19 reported to date among either residents or staff. We want to keep it that way. Staff have been and will continue to be screened daily coming into the facility to ensure that no infections coming in from the outside. That includes daily questions and temperature checks on the staff coming in. And then also we've got a great partnership with the North Dakota Veterans Home with the Fargo Veterans Administration Hospital. VA Telehealth has a specific node that's available for residents' care without having to leave the Veterans Home in Lisbon. They can receive the same care through point-to-point telehealth at VA facilities within the Veterans Home, ensuring that residents get the care without exposing them either to unnecessary travel or potential COVID infection. Veterans Home has temporarily paused visits from outside rotating care providers as well to limit exposure. And also there's been a substantial amount of PPE which has been supplied from the state's medical cache. We should also note that, again, to protect the residents who are there, there's been a temporary freeze on new admissions, but if a person is interested, there still is a waiting list is available to move into the home, and admissions will continue when the crisis is passed. Related topic, North Dakota Veterans Affairs. County and tribal veteran service officers remain available to serve veterans and their families and help provide with them filing claims. And whether it's due to variations across counties, whether it's National Veteran Service Officers, VSOs, they are available to help any veteran with questions, and that information can be found. If you're a veteran and have any questions about any of these programs, you reach out at nd.gov/veteran/service offers. We'll get you connected with someone who can help answer your questions. One of the questions that has come up, because people do worry about income-based benefits such as veterans, pensions, survivors' pensions, parents' dependency, indemnity compensation, the economic impact payments, this is the $1,200 per person that are coming out, will under the CARES Act, those are not treated as income or net worth in determining eligibility. So you can receive those checks. It will not affect your eligibility for VA programs. Also, the VA healthcare system, Fargo VA, and then the local community-based outpatient clinics. Everything in the military has got an acronym, so these are the CBOCs for those veterans would understand that. We've got CBOCs in our 8 largest cities, so Bismarck, Devils Lake, Dickinson, Grafton, Grand Forks, Jamestown, Minot, and Williston. I guess Grafton wouldn't make the top 8, but they've got in population, but they do have a they do have one of those locations, so they're spread around the state. And they'll continue to serve our veterans, but they've implemented screening procedures to protect the safety of those seeking care. Routine face-to-face outpatient visits have been suspended for a time being, but urgent and emergent care is still provided at the discretion of the physician. So the key, as we've been talking about, for these is, as we have, which is please call ahead if you think you need to be seen, so you can learn about screening protocols and maybe connect you with a telehealth option versus an in-person visit, but they're still working there to do that. One of the options is VA Video Connect. It's a secure option available to veterans to communicate with VA physicians on your own device. And as a leader in telehealth and with the support of the CARES Act, Fargo VA has placed additional emphasis on telehealth to make healthcare available. We know a lot of folks like to accompany veterans if they're going in on a healthcare visit, but a key during this point in time is to, if there is a need for an in-person visit, to make sure that you reduce the number of people coming unless necessary for transportation or medical care. In terms of the VA hospital itself, along with lots of other federal institutions, they've been working on their own preparation for COVID. And the Fargo VA has tripled the number of ICU beds, and they've doubled the number of general medical beds in their facility. And they've got a help call center. If you want to field calls related to this, call center is staffed 9 a.m. to 3 p.m. Number is 701-239-3700, extension 2319, and that would be where you can call if you have questions about the VA. VA is also seeking donations of homemade masks, and you can call and find out more about where to donate those. Next topic. One of the side effects we've been talking about during this whole crisis is that when for every action there's a reaction, and well, the action of slowing down the spread through physical distancing, good hygiene, and reducing non-essential travel, closing businesses where people would congregate, voluntary having faith-based organizations, we have reduce the number of transmissible moments between North Dakotans. But one of the things that we know is happening around the world as the world goes through this historic time of less interaction is that we're really, this isolation is creating creating a breeding ground for abusers. So it's bad for the virus, it's good for abusers. And we know that the United Nations this weekend on Sunday called for urgent action to combat the worldwide surge in domestic violence. We've mentioned this multiple times when we're here. We know that in North Dakota, hotline calls are increasing. Law enforcement's reporting increasing calls of domestic violence. That includes child abuse as well as domestic spousal violence. And we know this happens. We know because we'd like to think that Christmas and summer vacations are a time of always for joy when people are together. But anybody that works in this field would tell you that even over the Christmas holidays, calls go up around domestic violence. And so in addition to the physical violence, which of course is not present in every abusive relationship, common tools include isolation from friends, family, employment, constant surveillance, restrictions on access to basic necessities as food and clothing. And home isolation is vital to the fight against the pandemic. As I say, it's giving opportunities for those that seek control. This isolation may have also shattered support networks of friends and making it difficult for victims to either get help or escape. But we want to reach out to anyone who may feel they're in an unsafe situation or an unsafe home during this period of self-quarantine and consider creating a safety plan. One way to do that is to contact your local program or national hotline. In North Dakota, it's good that they're here. It's sad that we need them, but there are 20 crisis intervention centers located throughout North Dakota to help victims of domestic violence with counseling and assistance about getting protection orders or more. Remember that you're not alone during this time period. There are service and supports available to you at all times, including during this health crisis. We heard from Chris Jones speaking last Friday, who leads our Department of Human Services, talking about the work that we're doing to support these organizations that provide shelter and making sure that they have the resources to get through this surge in their needs at a time when needs are going up and donations are going down for most nonprofits. And so again, those sheltering opportunities are going to be expanded and will include individual housing units to protect people. So there is a place to call and there is a place to go. I think we have up on the slide here the website, cawsnorthdakota.org/gethelp. That'll help you locate your local center. There's a national domestic violence hotline that's listed here, 1-800-799-7233, and that is, again, these confidential to call. And another option that you'd have is there's a Native American specific number called Strong Hearts Native Hot Helpline, 1-844-7-NATIVE. To call. So again, that is that sad but necessary topic. And again, please reach out if you're able, and to one of these available resources if you have the need. Next topic, CARE-19 update. We know that contact tracing is a word that many of us didn't even know how to define over a month ago, and now it's going to be part of our daily life going forward. With a possibility of a vaccine months or, people have said 6 months, 12, 18, 24, even when it's available, then production has to ramp up. Even if it's the fastest a vaccine's ever been delivered on the market, we're still going to have a time where we're living with a virus that's deadly and does not have a cure. The best way for us to think about opening up the economy, as we've talked about, would be to have increased amount of testing, and then from that testing, when we find positives, do really comprehensive and thoughtful, systematic approaches to contact tracing to identify those who've had close contact to a positive, and then get those folks tested if necessary, or get them isolated. And that way we can be targeted in our isolation as opposed to these broad-based shut down the whole economy approaches. And this is a path that we have to go along, in addition to any businesses that would be part of reopening would have to think about new standard operating procedures going forward. But from a contact tracing standpoint, it's largely historically been a telephone and interview approach. We know that there will be technology that's applied to this problem, particularly when virtually everyone in our state has a smartphone, and virtually everyone in the state has got some kind of mapping capability already running on that, where it can give you the coordinates. And there are a number of scenarios for using CARE-19, the app, which is off and running. We have almost 16,000 participants using the app, and understand South Dakota launched it late last week. Other states are looking at using it but even if it's just here in North Dakota, it will be a benefit. For example, say we're down the road a couple of months, and we find out that there's someone tests positive, and that person, say, worked at a grocery store or other retail store that was open. They worked there, and you had used that as one of your locations where you'd shopped. You could be notified that a positive came up at one of the locations that you'd been at the last 5 days. And again, the app can do this without knowing your name, knowing where you live, knowing anything about you, because it gives you a randomized ID number specifically for this app, and the only thing attached to that app is location. And so we could be notifying all those random ID numbers, hey, you were at this location, you may want to be aware. So there's, in addition to the contact tracing in terms of helping you remember where you've been if you're ever contacted, there could be sort of aggregate public health applications that could be done confidentially that would make a ton of sense. And again, the more that we can apply smart contact tracing, the sooner that we can safely open up our economy again. In terms of unemployment stats, the Friday, the regular claims slowed down a little bit on on the perhaps because it was Good Friday and it was a holiday, but we were still open, receiving those claims. 1,114 claims came in on Friday. There was 369 of the pandemic unemployment assistance, and then 354 pandemic emergency unemployment compensation. Totals since March 16th, that would be 48,158 that have total regular claims, and just under 5,000 each since April 4th of the PUA and PEUC claims that have come in. There were claims that also were processed over the weekend, over 2,000 that came in over the weekend. So thanks again to our team at North Dakota Job Service and everybody in unemployment that continues to work 7 days a week to support all this activity. As we've said each time, worth reminding again, what's working here under North Dakota Smart is the same guidelines we've had in the past about great hand hygiene and staying home, only leaving if necessary, covering coughs. I mean, on a call this morning with Dr. Birx, with the Vice President of the United States, one of the new things that they're looking at to try to figure out could be a potential breakthrough, because there's been a shortage of swabs, is whether or not general Q-tips would actually work for taking a sample to see if someone would work, and that would again solve a swab shortage in a hurry of regular Q-tip. Well, why would a Q-tip, a short little Q-tip, work? Well, it turns out as they learn more about this, the viral load at the end of a person's nose is very high, and so it may be a simple Q-tip swab will actually work. 3 weeks ago we were using the long one that was 6 inches long and going up into the back of a person's nose and what seemed like the middle of their head to collect that, the pharyngeal. But as we learn more about this, again, those people that might be choosing to wear a mask, if they're for whatever reason, even if they're trying to either not get it or not pass it on to someone else, could be, again, a very good idea. See the CDC guidelines for that. But that's one of the things. Again, make sure you're covering your cough or your sneezes as one of the key things to do. And then, of course, keeping that safe distance in your activities that you're doing. So thank you, everybody, for being North Dakota Smart. I think we're seeing that individual responsibility is alive and well, and the vast, vast, vast majority of North Dakotans are following the rules and doing it with a lot of thoughtfulness, and from that I say thank you. In closing, a couple gratitude thoughts, and then we'll go to Q&A. On gratitude, again, people maybe wonder why we're talking about this, but I want to make sure that we're including this every time, not just because it's a different way of saying thank you to all the people that we need to share our thanks with. We're also talking about it each week because it's been proven time and time again by medical studies that gratitude actually supports health. It supports resilience both in individuals and in families. And so if you say, well, am I feeling gratitude or not feeling gratitude? Wow, my whole life's been turned upside down. This amazing disruption, whether it's been business being closed, kids that are schooling from home, whether it's fear that may be driven by all the information that you're being bombarded with across social media and cable news. Sometimes that information's conflicting, and sometimes it's just plain scary. And all these things can create a huge position of anxiety. But the whole point of gratitude is trying to create a state of emotional prosperity as opposed to the opposite. And like any skill, it requires practice. And we've said for the very first day that if you had a little extra time, one thing you might do is think about writing a note of gratitude to someone who'd made a difference in your life. That's a hard thing to do sometimes, to actually get out that pen and paper and write it down and find an address. I mean, that seems like a big lift to do that. So we're going to offer some more incremental things today. And I think the first thing we can do is to think about gratitude as just slowing down our minds from the rush of everything that's going on right now, so that we can actually connect back to our hearts. And it's not about pretending that things are okay when they're not, but it's about gratitude can be about even connecting with some small shred of appreciation, and whether that's the traditional word of thanks before we eat some food, And maybe it's thanks for the people that prepared it. Maybe it's for the people that grew the food. Maybe it's thanks for Mother Nature and the dirt and the rain and everything that went into growing that food. If you got more energy, you can practice, in a gratitude journal in terms of writing down, keeping notes to yourself in this time that's very unsettling, keeping a list of things that you're grateful for, maybe unexpected kindness that happened from a friend, a neighbor, or a grandchild. That would be something that you could write down and refer back to. And something that I found to be a great benefit all the years with our kids, Joe, Jesse, and Tom, at night before they went to bed, would have them recite a list of 3 things that they were grateful for from that day. And that's just a great practice. And again, so I would say to everybody out there when we're talking about gratitude is to try to get that muscle even stronger right now, because it's one of the things that's going to help us as individuals and as families and as a state be part of our perseverance and our resilience. So with that, I want to give out a special shout out, as I always do, to under the gratitude section. But today, the gratitude shout out goes to all the moms and dads that are juggling more than they would normally do, because you're probably also, acting as a teachers or helping kids with their homework and their assignments. Some of you are essential workers that are still working. Others are worried about aging parents that you can't go visit and see. Some of you are probably trying to figure out how to work and keep your small businesses going, even though they may have been closed. So we know that there is enormous pressures that your family has never faced before. But as we know that North Dakota, our heritage across all our cultures is rich in perseverance, rich in innovation. We know that you will come out of this stronger than ever before, and therefore we know our state will. So thank you to all the moms and dads that are out there doing all the great things you're doing, and thank you from the bottom of our hearts for all that you do. And again, I want to say, at the beginning, again, when we face this crisis, when we have deaths like we did on Saturday, and again today, which we'll report in tomorrow numbers from the First Lady and myself, our hearts go out to those families who've lost a loved one. We know that regardless of the circumstance, it's never easy to lose a parent or a grandparent, and so we know that all of us are with you and thinking about you. With that, I'll stand for questions. Thank you. I think Dave Thompson had it up first, Jeremy.
Sorry to beat you there. Just going back to Montreal, you had the targeted surveillance or testing there. What's the criteria for targeting, for using a strike team?
Well, in this case, we were looking at where we had potential hotspot outbreaks. So we're looking at the numbers of positives that had come in per county. And then we reached out to local officials, and the local officials, in this case, Tribe and local clinic, they had been assisting on the contact tracing, and so they provided, there's a combination of working with them, local leaders, tribal leaders in the State Department of Health to assemble the list of 100, I think it was over 100 names of people who were invited to come and get tested, and then it was also open up to others in the community, and I think there was 260 plus tests that occurred, but about 40% of those were people that we had invited through the contact tracing process, which is, I said earlier, a reason why we likely came up with a higher percentage of positives, because it was probably a more target-rich environment for testing.
Have you figured out a next target yet?
Have not figured out the next target yet, although we did have, there was a team that was back up there again today at this same location. We did have a minor glitch where 69 of the tests that were collected on Saturday were running through one of our older machines at the lab. We do have, as we've talked about, some new Abbott M2000. These are the large scale, sit on the floor, do hundreds of tests a day per run, but one of the older machines had a seal that went out. We've contacted Abbott. Technician is working on getting it repaired, but in that case, when the tests, in the process, there's a thing called a kill step where the virus is actually killed, and it killed it. We didn't get a readout, and then there wasn't any live virus left to redo the test. So then we've got to, so when they're up there today, doing between 100 and 200 more today at that drive-through today. I know, I guess, understand the weather's a little inclement, but before they opened up today, there was already 40 people in line. But we've invited those 69. We've notified the 69 individuals where we had the test machine malfunction, and we'll retest those individuals.
Governor, will the state's statistical modeling be released tomorrow?
I'm uncertain of that. We had a long meeting on Saturday, and again, I think, well, I can say for sure, modeling singular is not going to be released tomorrow. The model that we're working on produces multiple scenarios, and scenarios are not destiny. It's just one of the inputs we're using, and I know there's a fixation on the, quote, the model, but there is no such thing as a model. We'll have a sophisticated model that will produce various different scenarios, and the outcomes of that would vary and change based on what we do. If we, and again, very hard to predict human behavior, but if we decide to open up on X date and we're trying to predict through the summer versus if we open up on Y date, those would be two different scenarios. Because if we do start to open up, then the amount of transmissible connections probably increases, and therefore we would expect to see cases potentially increase. In talking with the scientists and the modelers, there's nothing yet that says that we can count on having this disappear over the summer. And so again, part of the modeling that we have to do is not for the next few weeks, but it's really over the next 12 to 18 months. But like the weather, I mean, maybe some of you believe in the Farmer's Almanac. Sometimes it's right, but it's like, it's tough to forecast weather. Maybe you can forecast weather for an hour from now, and sometimes for 8 and 12 and 24 hours, you can be pretty accurate, but try to tell me what the weather is going to be 2 weeks from now. It's like insisting to see, what is the model, the weather forecaster using to predict the weather in June. I mean, it's just a very inact science, but it's an input, and we want to use it as one of the tools we have, but we'll you keep refining it. And of course, one of the ways we're refining it, like we did over the weekend, is getting more data points into it. We've got actually so few positives when you're talking about 300 positives. I mean, a model like that versus a model for another state that might have 10,000 positives, our data is, I've said before, it's latent, but it's also small quantities. So we want to be cautious about how we use that. But I also want to be transparent. I'll be happy to keep sharing with people what we're using and all the inputs we're using as we go through this. Jacob?
At least out east, there are a collection of about half a dozen governors that are working on plans to reopen their economies. Obviously, a different situation out there than here. When they say that the worst is behind them, when you talk to regional governors here, what are your gauge as to where we are right now?
Well, in terms of the regional governors, the ones that I have stayed in regular contact with include Iowa, Nebraska, South Dakota, Minnesota, Wyoming, Montana, and the two premiers from Manitoba. I don't think anybody in this region, the Upper Great Plains, thinks that it's behind us. We've said all along there's going to be different curves for different parts of the country, and so we're not there yet. And one of the challenges that we'll face in North Dakota is that we're going to be, we might be going up when other states are on their way down, and that's going to be confusing for people if wow, New York had all these deaths and they're opening up, why aren't we opening up? That'll be a communication challenge for us, but we have to just keep monitoring and see where we're going on this.
Sanford is working on a
Travis, make sure you speak up loud so they can hear you all the way up this mic up here. Thank you.
announced that they're working on a trial with hydroxychloroquine. Is that system-wide for Sanford, or is it South Dakota only, or do you know of any North Dakota facilities where that will be tested?
We got asked this question last week. I think Lane asked a similar one, and this is Travis from Bismarck Tribune. Thanks for the question. We know that there are multiple multiple systems and multiple doctors in North Dakota that are trying this, and that's up to the providers. What they're using is a therapy that includes the malaria drug. It's sometimes combined with zithromycin, also popular known by its name Z-Pak, and those therapies, there's some belief that it works. I say belief because there's not a double-blind clinical trial. Here's the people that got it and here's that didn't, and they got it on the same day and the same rate of infection. And there's a general sort of, I'd say, discussion that it is that if it's delivered in the final throes of someone's disease and they're in their last day or two fighting for their life, may not be effective, but if they get it early enough, it may be. But that's, again, the medical providers are doing this. They don't need any special FDA approval because these drugs are proven. I mean, these drugs are authorized drugs. One for malaria, the other one is an antibiotic. Antibiotics typically are not used against viruses because they don't work against viruses. That's why if you get the flu, nobody gives you an antibiotic because it's like, hey, you got a virus, you got to rough it out. So, but in this case, so again, we don't have any specific double-blind medical device thing, but there are people that are trying it here, and again, I would divert your questions away from the state. The state's got really no role in regulating those drugs, and we have no role in prescribing or recommending or not recommending. That would be up to the medical officers at all of the facilities in North Dakota, so I'd refer you to them. Lane, and then online.
Governor, about 2 weeks ago when the weather was really nice, you had mentioned that your office was getting a bunch of reports of large groups out at parks and gatherings and such. Even though the weather is now turned around a little bit, are you still getting those same reports, or is it kind of slowed down?
I think some of that was, I don't want to call it, I want to be light about this because certainly one of the indications of this COVID-19 is a fever, but I think there was a serious case of spring fever going on in North Dakota when you had the first day above 60 after the whole winter's going on. Pretty hard not to want to get outside and get a little sun and do that. Certainly when we've had got snow on the ground across most of the state again today, I think the amount of outdoor gatherings and groups has gone down, and we probably also have a couple more weeks of people understanding what we're up against. And again, as we one of the negatives as we get more positives is that we have more people that have been infected. One of the positives of more positives is that more people know somebody who is affected by the disease and then understand how tough this can be, and they understand how fatal this can be. And so therefore, I think that we've, getting over time, what you will see is increased compliance for a period of time, and as people understand that they want to be part of the team that's slowing the spread versus increasing the spread.
Travers with 660 KEYZ in Williston. Governor, do you have any ideas as to why there's a high number of cases in Montreal County, and do you find it concerning that there's more positive there than compared to more populated counties such as Williams and Grand Forks?
So Robin, thanks for the question. The number of cases, I think, again, through our contact tracing can go back to if you have somebody who's positive that's in a position where they have contact with a lot of other people, you can end up with a sort of a mini hotspot like we have in Montreal County. And that's what occurred there, but that can occur in any county. It's really could have happened in McKinsey, could have happened in Williams. We got, two of those, now up in Burke. I mean, it's like it could happen anywhere. And we're seeing this in other states. It could be in a particular facility, like we've seen a couple other states with the outbreaks in food processing plants. This is something that's going to happen, is there's going to be places where it pops up. The key is that understanding A, it could happen anywhere, and B, when it does, we want to have this rapid response capability like we're demonstrating in Montreal, which we test drove a couple weeks ago, and whether it's a nursing home, where if we have an outbreak in a nursing home, we want to get the individual that tested positive isolated and away from the other folks. We want to come in, as we have now on several occasions, and tested the entire nursing home and all the staff. We want to be able to have these rapid response teams that can do that. So that way we can turn what I'll call a mini hotspot into something that doesn't blow into a huge prairie fire. We want to contain it, and that's a skill set that we have, not just for today or tomorrow, but that's something we're going to have to build and have for a long time. So as I said, testing, contact tracing are going to be part of our way of life, and we have to get really, really good at it. Danny?
James McPherson with the Associated Press. President Trump said today that he is the ultimate decision maker for determining when to relax social distancing guidelines, not the governors. Do you agree with that statement, and why or why not?
Well, I think what he actually said was it was the decision relative to open up the states. I don't think he made any comments about social distancing in the tweets that he had. And so to be clear about that, and he also said it's a decision, made by him in conjunction with the governors and input from others. We found that the White House has been extraordinarily accessible in terms of their communication with us. And again, today we had an hour-and-a-half long phone call with the vice president and all the governors from around the U.S. And the staff. We had a great call with Dr. Fauci on Friday night for 40 minutes, one-on-one with officials from North Dakota. Prior to that, the call with Dr. Birx. I mean, so we're getting incredible, great access from them. And I think that the White House certainly understands, and their advisors understand, that the curves are going to vary across different parts of the country, and so there's not going to be a one-size-fits-all in terms of when the nation, quote, opens up again. It's going to have to vary by region, just like it varied on the closures. And I know that they have said over and over and over again that it's going to be federally supported, state managed, and locally executed. I don't see that there is anything that was said today that's a change in that direction. Lane, and then Dave, and then Jacob.
Governor, over the weekend, I noticed while I was doing some grocery shopping that toilet paper and paper towels are starting to return to grocery stores, but some people are still telling us that other stores are still lacking in that department. Have you heard from any people or producers that they're lacking these products?
Haven't heard, and I can only imagine. I've never worked in an industry that produced paper products, but I imagine this has been a difficult time for them because they've probably ramped up production to meet the highest peak need they ever have, and then when we get through the backside of this thing, they might not sell a roll of toilet paper for a year, and so maybe their plants will all shut down. I'm not sure, because I'm not sure consumption of toilet paper went up. I think just home inventory went up, so there was a surge in home inventory of toilet paper and maybe paper towels. It turns out, as we've mentioned before, that if you look back at the history of humankind, at least over the last 10,000 years, no civilization has risen or fallen based on how much toilet paper they had stored at home. And so it's a curious thing to me that was like that'll be maybe one of the things that if there's any humor looked back on 2020, if there's any humor in a pandemic, maybe it'll be that was the thing that was so coveted. In terms of that time and during this time frame, but it's good that maybe people are understanding that they don't need to have such significant supplies of home inventory. That's a polite way of saying hoarding, but so maybe we'll get through this. But I applaud all of the distribution centers, the people that work at distribution centers, and all the stores that have kept the supply chains rolling, the manufacturers. I mean, this has really been an interesting and challenging time, and you got to sort of understand the miracle of the private sector and free market, which is keeping the nation supplied with all these goods without, really the government having to get involved in any aspect of that thing. We should really take that as another point of gratitude. Dave?
If I remember correctly, I think you said that by the 15th, which will be Wednesday, you'll have more guidance on when and how businesses will reopen. Are you still going to try to stick to that timeline?
On Wednesday, yeah, we want to give some guidance. I think we didn't say when and how. I think we said on the 15th we would announce whether or not we would extend the 20th longer or not. So I think that's what we'd be. we'll try not to raise the size of the self-assignment for Wednesday, but we'll stick to the assignment we gave ourselves, was provide guidance on that aspect. Because right now, some of the business closures end a week from today under the current executive order. So by Wednesday, we would give people lead time if we're going to lift that or not. I wouldn't shade it one way or the other right now, but I don't know that when we're still in the flat part of our curve that we could do the things that other people might be speculating that we're on the backside of it. I don't think I've seen anything yet that says that we're behind it yet. But that doesn't mean we're not going to keep digging into the data every day. But the data is going to be a little light the next 2 days because we probably had less testing occur yesterday because of Easter. So nothing tomorrow, but maybe by Wednesday we'll have a little clearer picture.
Governor, we've been getting reports that some major health systems around the state will be furloughing significant numbers of their medical personnel. Is there a concern that once either our spike hits or even once this whole pandemic ends, North Dakota's health systems might be understaffed because those people moved somewhere else?
Well, I would hope that those folks would not move, would hope they would stick around, and I hope furloughed has got an implication that it would mean we're going to have you back as soon as we can. I think the incentive for many organizations right now when they see the robust unemployment dollars that are out there, both at the state level and the federal level, and you've got your revenue has dropped because your customer demand is down, say for clinic visits and for non-mandatory surgeries, elective surgeries is the word I'm looking for, that if that's a source of revenue and sometimes substantial revenue for people to do that. And it's not saying it's elective, doesn't mean it's not important. I mean, if somebody needs a new hip or a knee, that might be a life-changing experience for them. If somebody needs certain other kinds of health treatments. So we probably are foregoing some things that the general public normally, it's not a good idea to postpone health care, and we want to be very careful to realize that we're not, particularly when we're looking at that number of only 13 beds being occupied in the state by COVID patients. But if you're a hospital organization wondering about how you're going to make ends meet, and you know that if you furlough your people and they can apply for unemployment and be granted unemployment and have the federal kicker behind it, I think a lot of businesses and private sector nonprofits, a lot of people might go, hey, it'd be a good idea to let the feds pay my staff's wages for a while we get through this thing. I think that's one of the reasons why in the calculus you might say, well, gee, maybe we're not opening up everything, but let's re-kickstart the healthcare system at least, so that people that may have been deferring important procedures could go back, and that they could feel safe and comfortable that if they go into a clinic or get a surgery, that they're not going to be exposed to COVID. But at the levels of hospitalization we have right now, that certainly would seem possible. But I hope that none of those people leave North Dakota, because we had a shortage of healthcare workers in North Dakota a month ago, and I'm guessing that in the future we're going to still have a shortage as opposed to a surplus. And we'll also, in addition to the unemployment, the hospitals themselves are getting funding from the federal government through the CARES Act, and in talking with Seema Verma, who leads CMS for the federal government. That's all of the Medicaid, Medicare things. She was on the call again this morning. I would just encourage all the medical providers to keep checking on all the rules, because she said again today there's new rules and new flexibility that's going to allow them in terms of how they do billing on all kinds of things. And some of the billing that used to be partial, now it's 100%. I think there may be creative ways for hospitals to retain their staff and get reimbursed as opposed to furlough them. I would get that would be on your game plan if you were a business leader, to say, hey, how do we navigate this huge downturn in revenue? But there are multiple ways that healthcare organization could receive aid. One is through unemployment, and others could be direct payments through the CARES Act, and others could be through your traditional reimbursement from CMS under new rules, where you're getting reimbursed for stuff that you didn't get reimbursed for before, particularly as it relates to Medicare and Medicaid. So they've got at least 3 options that I know of to help support their revenue during this period of time, and I know that the leaders of those organizations are looking at all those options aggressively, and we want to support them in doing that.
Governor, I'm not sure how much you've been reading up on the news for our neighbors to the south, but they've had quite a large breakout at a meat packing plant. I'm just wondering, I guess, what kind of safeguards there are here to make sure that doesn't happen, and how we would deal with it if something like that did happen.
Well, I think this is a good lesson, because it wasn't just in South Dakota. This has happened all over the country where there have been outbreaks like this, and it would and it wouldn't even have to be at a food processing plant. I mean, just take a food distribution center that would support our grocery stores, or a distribution center for one of the major retailers. I mean, if you had an outbreak at one of those locations, you could have that, the same kind of impact. The good news is that there's no evidence that this gets transmitted through food, so I don't think there's a food risk that's associated here. But when you lose your labor force, that's an issue. For us to get back to work in any kind of environment, whether it would be a manufacturing plant in North Dakota, a distribution center, any place where you've got a congregate set of people, or maybe it's operating 24 hours a day and lots of people coming and going, this is where we have to have the widespread testing to make sure that we're safely getting everybody back to work. And the testing would have to be in the form that is more efficient than what we have now, which is, we've talked about the serological or the blood testing, which is the finger prick testing. That's where you could envision that every person that works in that plant gets tested on a Monday morning before they come into the plant, and then you might, on every other day, you're checking temperatures with the scanners and doing interviews about, are you living with a positive? You've been exposed to a positive? You've been come in contact with a positive? You've been contacted by the contact tracing team? You answer those questions and do that maybe on other days, but, we should be thinking about the fact that you're not going to get tested once when you're sick, that you could be getting tested multiple times over a period of time if you're in a workforce. I mean, if you're working in a power plant, or someplace like that, essential critical infrastructure. These are places where I think we'll see it first, where testing is going to be a necessary part of keeping that workforce going. And for us in North Dakota, part of that, again, if that were to happen here, where we had an outbreak of that scale, this is where the rapid response teams, where you'd want to come in, test everybody that had been in there, and then do the contact tracing with everybody that's in there, and then isolate those people, including whether it's family members they're living with or others, because you get 60, 70 people, and then they've got contact with 6 to 12 other people. I mean, things get big in a hurry, and that's what we're trying to avoid. So far, we have. Another question from online.
As a follow-up to the question about hospital furloughs, Gene Schemp with Hometown Radio Group in Minot, with the layoffs currently in effect in the medical community, is there a concern that patients in need of medical care today might not be taken care of?
Well, I think that's a question for the medical providers. I think that their medical providers in North Dakota are smart, and they're savvy, and they're going to staff at the levels that anticipate their demand. And I think if someone's furloughed, they have the ability to pull people back relatively quickly back into an active workforce. I mean, pull them off the bench and put them on the floor. So that's not a concern I have, but that's based on what I think is the sophistication of the labor models at all the North Dakota providers. Thanks, Gene, for the question. One more from online.
Eric Arndt with KZZY in Devils Lake. With no coronavirus vaccine available currently, and given the possibility of creating an environment that could lead to more community spread, is reopening school buildings off the table for the rest of this academic year?
I don't think anything's off the table right now, and again, the school buildings themselves aren't the issues per se, and so we're, you know, again, and when we do quote reopen, we think of like, hey, we closed them in a hurry and we're going to reopen them. You know, could you reopen a school building with very different operating procedures in terms of distancing? Yeah, perhaps you could, but it's just like all the distance learning was completely new and a fast approach that got implemented. And again, great job to all of the school districts and the teachers and the principals. I continue to hear great stories from parents of students of all ages in terms of how that's working, and so again, thanks to everybody that's doing that. But yeah, when we time is probably now that the leaders in those organizations should be thinking about what would limited reopening look like, and whether that's now, this summer, next fall, you know, because it's very likely without a vaccine that we're going to have. They could have a return of some form of this next fall, and we want to be able to get through it without having to shut down the whole economy. And so then how do you think about, you know, how do you think about those new standard operating procedures in all of our businesses and all of our activities so that we can get our economy going again, which is good for health and good for lives, but also maintain the spread so that the spread of the virus stays below our available hospital capacity. It's like keeping those two curves apart from each other as we get back to the new normal. One more question, if there is one. We got two quick ones. Okay, we'll do two quick ones, one online and one for Lane, and then we'll.
April Baumgarten with the Forum Fargo-Moorhead. There are a number of county fairs around the U.S., including in Michigan, that are canceling youth programs such as 4-H shows. Do you think county fairs and the state fairs should continue as planned, or is there a concern that the virus could stick around?
I think that's a question for those organizers. Again, if there's, you know, 4-H in part of the example question is a fantastic program. If there's a way to hold 4-H contests, do it virtually, and kids submit their stuff and someone judges them, they still get a blue ribbon, but maybe you don't have a whole crowd of people in one building. I mean, I would say a little bit like distance learning for schools. I mean, there's going to have to think about new ways to approach it. I'm sure that Boy Scouts, Girl Scouts, and other programs like that are figuring out how to have virtual meetings but keep people working on merit badges. I know a lot of kids in 4-H that might be doing projects, whether it's raising, you know, a hog or a sheep or a steer. You could still be doing that, and maybe the auction for that is happening online. So I would encourage people as to not think about, you know, on or off, yes or no, but how do you develop and keep things going in a world that's in a world where we have to come up with new operating procedures. You know, the big events, state fair, Red River Valley Fair, county fairs where we congregate people, I'm sure those are going to be very difficult to think about doing those as we normally would. But, you know, maybe, you know, it's hard to think about everybody sitting at a concert X number of feet apart and everybody wearing a mask of their favorite rock band or country band. But, you know, we got to think about a new world where there could be new procedures as opposed to we're not doing it all versus are we willing to do it when we've got new approaches and think about new ways of connecting. And so that would be, again, back to those organizers to think creatively, just like every business owner and every organization and every health organization, every school has had to do. Everybody's got to start thinking differently about how you operate until such time when we've got a vaccine. Lane, last one, is it a yes or no question? Be the first one in a month?
It might be.
Okay.
Governor, if somebody were to pass during this time and not know if they have COVID-19 or not, are they being tested afterwards?
We do have some families who, in conjunction with their medical providers, have made a decision to do an autopsy after the person has passed away to confirm whether or not they did have COVID at the time they passed. So there is some of that going on. I don't know all the statistics of the 9. I know of at least one autopsy that was done where the result was negative. It was not COVID, was part of that. But so I know that our people are trying to get that answer to that question. Okay. With that, we want to say thank you again. Hope you all had a happy Easter. Thanks for tuning in, North Dakota, and we'll see you again tomorrow at 3:30. Stay healthy, stay safe, stay home.